Digital mammography remains the gold standard for screening of early stages of breast cancer. Film and digital mammography are similar in their ability to find cancer. However, because digital images are viewed on a computer, they allow for the radiologist to capture and manipulate the images so abnormalities can be seen more easily. Radiologist Dr. Fred Wittenstein explains how Florida Hospital Waterman's Digital Mammography Center takes advantage of the capabilities of digital mammography and why it's so important in the fight against breast cancer.
We use digital mammography as a screening technique, and it's a quick and easy test to get a look at the breast. The X-ray film has traditionally been the way mammography has been done for many, many years, and the transition takes some time. Digital mammography equipment is very, very expensive. The reimbursement is not very much more, and so the facility has to have the commitment to care to want to spend that extra money to be able to take care of the patients better. Digital mammography is an advance in the techniques of doing mammography where all the data is captured. Instead of using film, we use digital computer technique. And what that means to the patients is that we can do the exams quicker, we can get higher quality images and be able to see things that we couldn't see before. And then these images can be reviewed and can be transmitted anywhere very easily, and overall provides a better level of service. The interpretation is very similar to interpreting a regular mammogram film, with the exception that we do it on a computer screen instead of on a piece of X-ray film. But the quality of the image and the contrast of the image and the breast densities are so much more improved that you can pick up smaller things, smaller cancers, smaller calcifications, smaller suspicious areas, and so you can catch problems much earlier, which leads to a better outcome for the patient. That's of the utmost importance. The most important thing for a woman who's getting mammograms is to be diagnosed quickly and early. Cancers take a long time to grow, and when a patient comes in for routine screening and a cancer is picked up that she didn't even realize was there and couldn't feel, she has a much better chance of surviving a long time or being cured. We can pick up cancers that are only millimeters in size, and with digital mammography, our sensitivity for picking up these early cancers is much greater than it was before, especially in young women and especially in women that have very dense breasts. One of the biggest advances with digital mammography is the ability to take pictures of women that have dense breasts. Because before with film screen, it was very hard to see what was going on. But now with digital mammography, you can see the density is much better because there's so much improved contrast. There's a lot of information on a screening mammogram. Sometimes a screening mammogram is not enough to decide what's going on, and we have to call the patients back for what's called a diagnostic mammogram. A diagnostic mammogram is additional views of the breast, some of which may be magnified or compressed in a different way. Depending on what the results of that diagnostic mammogram is, we can decide what course the patient may have. The majority of the women go on to routine screening afterwards. You don't need to have any kind of procedure done. Some women, after the diagnostic mammogram, need to have an additional test, such as an ultrasound, which we can do in the department right then and there. If the woman should need a biopsy after all these tests are done, we call her physician, try and schedule it for her at that time, explain to her what the procedure is and how it will be done, and get everything set up before she leaves so she knows what's going to happen. The overall experience of having a mammogram greatly depends on the staff at the facility. Our staff is well trained. Our staff is very friendly. We have a lot of people out there laughing while they're having their mammograms. Unfortunately, that causes motion, but it keeps people happy, and it makes for a very good experience.
Florida Hospital Waterman has been designated a breast imaging center of excellence by the American College of Radiology. If you'd like more information about their digital mammography services or to schedule an appointment, follow the Going Digital story link on our homepage at yourhometownhealth.com.